So, Marshall, last we spoke, I don't know, about a month or so ago, we were you were telling us the story, which is one of the ongoing sort of threads, I guess, ProPublica is pulling on why we have some of the most expensive healthcare, or the most expensive healthcare per capita, and I guess in real dollars probably as well, of anywhere else in the industrialized world. And last time we were on, you were talking about the I guess the wastefulness and really in some ways the profiteering involved in the simple combination of two drugs readily available, putting them together into one drug and then charging exorbitant fees, because to a certain extent there's a certain amount of playing on the ignorance of the public and probably even those who dispense of the medicine in some respects. And this time around, you have tackled what you call the myth of drug expiration dates. And I got to tell you, this has been an ongoing debate in my household. And I never now make the mistake, although I may start again, of going to like a Costco and buying a big thing of Advil and then finding out like a year or two later I got to throw it away because we haven't gone through half of it and it's expired. But you dug into this.
Yeah, so I dug into it, and like you said, Sam, it is one of the great, I think, domestic debates going on all over the country. You know, you have people who look at the expiration date on a pill bottle, and as soon as it crosses that particular date, they take the thing and they throw it in the trash. And then you have people who are more laid-back types who see something that's years past its expiration date and still take it and say that they're just fine. And so I got interested in this story because I was contacted by a pharmacist at a hospital in Boston, and he told me that he doubts the expiration dates on all the drugs that he has to throw away. And of course, you know, hospitals are much more strict than we are in our consumer medicine cabinets, right? There's no law that tells us that we are not allowed to take expired medicine. But in hospitals or medical facilities around the country, they have very strict laws and regulations that say that they must throw away anything that's past its expiration date. And so I went up to Boston and visited this pharmacist. His name is David Berkowitz. He's at Newton Wellesley Hospital, just outside Boston. And he showed me he has a shelf in his pharmacy. You know, it's probably, you know, it's like one of these floor-to-ceiling shelves that you might have in your garage or in your storage room or something. And it was filled with bins of all different types of drugs that had passed their expiration dates. You know, there was a big box of EpiPens, there was atropine, there's sodium bicarbonate, all these different drugs that he has to pull off of his shelves and manage his inventory and just toss in the trash. And he said that in his hospital alone, he throws away about $200,000 a year worth of expired drugs. And if you were to calculate that across the hospitals nationwide, you're looking at about $800 million in drugs being thrown away just in hospital pharmacies.
That's extraordinary. And I guess maybe we're a little late, but better late than never in pointing out that the biggest problem that we have within our health insurance delivery and access, the biggest driver of cost of our health insurance is not, contrary to I think what people think, is a function of health insurance, but rather just simply the cost of our medicine for whatever reason, and one of these apparently is this, is just that much more expensive than others.
Like you had alluded to earlier, everything in this country is more expensive when it comes to healthcare. We pay about twice as much than any other country in the world in terms of developed countries for healthcare, more per capita than any other country in the world by about 2 times. And this whole project I've been doing is looking at why these costs are so high. And experts estimate that we are wasting about $765 billion a year. That's a billion with a B. And all that money, that's about 25% of the total healthcare spend every year. This is one of the biggest parts of our economy, and we are throwing away hundreds of billions of dollars. And so I've been trying to document as many cases as I can where we're needlessly throwing things away with the hope that if somebody were to make some changes, if some leaders took the initiative to address some of these problems, we wouldn't have to have the big debate that we're having in Washington, D.C. right now over coverage and over insurance and over Obamacare. All they're talking about in D.C. right now is how to cover all these people. But the reason it's such a challenge is because it is so expensive. And what they're not debating is the underlying cost and why things are so expensive.
To a certain extent, even, and I happen to be a single-payer supporter, but even the single-payer, when we talk about single-payer in terms of as a cost containment, not in terms of its universality, but in terms of cost containment, is a bank shot, right? Because the value of having a single payer in terms of cost containment is, and obviously there's some savings in terms of the administrative costs and the lack of profit, because the government's not looking for a profit on the health insurance. But the single biggest element of that in terms of a cost containment is that you have theoretically one entity that has the data that can say things like, that can basically negotiate and say, hey, we have the data to establish that this procedure or that procedure is not medically necessary or is not cost effective, or that we need to see certain reductions in your, let's say, I don't know, prescription drug waste to push this forward. It's really, so it's all sort of second order stuff. But,
we have a very fragmented system, and there's no accountability. There's no one keeping track of this. So even when it comes to something like how many drugs are thrown away because they're expired, no one's actually tracking that in an aggregate way to say across the country how much is being thrown away. The drug companies, I think they are tracking it, but they won't tell me. I mean, they don't make this information public. They wouldn't tell me when I asked them. And back to the expiration dates, the thing that's most surprising to me is that no one is actually checking to see how long the drugs actually last. And so every drug is different. So when they've tested drugs, they have found...
Now, wait a second. Before we get to this part, because I want to I want to get into this element about it, because I think there is an assumption by everyone that they look on a bottle and they see an expiration date. They don't want to take it after that date because it may harm them in some fashion. And there is some assumption, I think, that we make when we see that printed on a bottle and we presume that it's mandated that expiration date is printed on the bottle, that it's there for a very specific reason. And it turns out that reason may ultimately be just about the profits of the drug companies.
Well,
we got to take a quick break.
Yeah, I don't think it's a dumb reason to assume that they expire, because the term expire means that something is bad, and it's actually not an accurate term to put on those bottles, because we're going to take a break, Marshall. We're going to take a break here. When we come back, we will address that very question. We got to take a quick break. I'm Sam Seder. This is Ring of Fire Radio. We'll be right back after this.